I am a bilateral lung transplant patient at Johns Hopkins, and during my hospitalization, I ran into a couple of problems which required that I have a what they call a PICC line installed, which basically allows medication to go directly into my heart, and in addition, I required a feeding tube. So when it came time for discharge from the hospital, the doctors still had me on both the PICC line and the feeding tube. In addition, there was a visiting nurse that was going to be required to visit me on a monthly, or actually a weekly basis at a certain specific time, because my blood had to be drawn at a specific time of the day to measure the proper level of rejection drugs. Also had physical therapy scheduled, and also had speech therapy. Now, most people would say speech therapy, that's sort of unusual. Lung transplant patients experience a problem with their esophagus after the transplant. It weakens. So we have to go through a process of re-strengthening our esophagus so that fluids or anything might not leak, won't leak back into our new lungs. So you end up with a wide range of interactions with the home health group. We had to order the IV medications, which had to be specially prepared, brought refrigerated, so that you're limited as to when you can order, how much you can order. So there was a timing on that. In addition, there's a special procedure you have to go through with this IV medication that ensures that the PICC line is clear. There were two accesses to the PICC line, one to draw blood and one to infuse the IV medication. The nurse went through a process of training both my wife and daughter with the sterile techniques that were required to keep the PICC line clean, and that takes some effort, especially to people that are somewhat apprehensive about suddenly dealing with a line that goes right into the heart, and the concern of the potential of infection. But she did an excellent job, trained them to where they were comfortable. She required them to go through the process a couple of times so that they were comfortable before she would allow them to actually do it. The supplies that I was required, we had a single contact that did really everything for us, both the feeding tube supplies, the IV drugs, and then all the other additional requirements, gloves and alcoholic swabs, and plus the injections that were used in my PICC line. So I had the opportunity to basically see a lot of the home health group after my surgery.